representing the various ministries and answering the questions that matter to us. Join the conversation. This is the Front Bench.
This is the Front Bench. We are coming to you live on our different 11 radio stations. We are coming to you live on our YouTube channel, but also our X handle at UBC TV. Use that hashtag UBC Front Bench. 0709602592 is our WhatsApp number. Please be part of the conversation. Ebola outbreak in Congo. Uganda activates high alert. Now, yesterday, President Yoweri Kaguta Museveni did release a document, a letter, indicating that after consultations with National Epidemic Response Task Force and religious leaders, we have decided to postpone the Martyrs' Day to a later date, which will be communicated. Now, this decision was made because Uganda receives thousands of pilgrims annually from eastern Congo, which is currently experiencing an Ebola outbreak. To safeguard everyone's life, it is essential that this important event be postponed. I encourage those who had begun their journey to return home, continue observing the precautionary measures, report anyone who is sick, and encourage those who are ill to seek medical care. We regret any inconvenience caused, but the protection of life comes first. Now, the Director General of World Health Organization, Dr. Tedros Adhanom Ghebreyesus, did also come out on the same tweet, replying to what President Museveni did tweet. He said, "We thank the government of Uganda for their swift action and all precautionary measures to prevent Ebola from spreading further, including the postponement of Martyrs' Day commemoration. We will continue to work closely together to protect the affected communities and to end the outbreak." What does that mean? Now, this is an international concern. I do have the PS, Dr. Diana Atwine. Doctor, good to have you on the Front Bench. Thank you for always sparing time. How is the current situation like as far as the Ebola outbreak is concerned? Not in Uganda, but in Congo. But since we are neighbors, we are one.
Yeah. We got to know about the outbreak in Congo on 14th of May. And at that time, they had reported a number of deaths. And I think, to be specific, there were around 80, although quite a number of those were not confirmed because they died in the communities and were buried, and they had confirmed 13 positives at that time. But what we have right now is that epidemic has spread. Initially, it began in Ituri, in 2 areas. In the regions in Ituri province, but it has since spread to Goma and I think in some other areas. So it looks that this is a widespread problem, and so we need to work together. That's why we are very active and very concerned that we cannot do things the usual way, even here in the country. And that's why we have activated all our systems. That's why we have deployed people at the borders who are screening. And that is the reason we postponed a very important annual event that brings so many people, many nationals into the country. For the time we are in, we couldn't afford to let this mass movement and gathering. Yeah.
PS, Uganda has an experience in handling Ebola. Did the previous lessons strengthen the system, or we still have some gaps that remain?
Now, the country has had experience because we have had previous outbreaks, and we always handle it effectively in the shortest possible time. And even this time, we know that we'll be able to manage this problem. We have over time strengthened the laboratory capacity. Before, I remember the first outbreak that we got in Uganda. We had to ship the samples to CDC Atlanta to be the one to test. But when I look now at the capacity that we have built, we are able to detect any outbreak within 24 hours, anywhere in the country. We are able to test all the diseases that can be tested in the country. We are able to do genomic sequencing. Even now we know this Ebola, particularly the one that came from DRC, we have already done entire genome of that virus within less than, I must say, like 24 hours. We are able to do that, which is not, it has not been done in any place, in anywhere. So we have built capacity in the laboratory capacity, because now, even now, our labs are there stationed in Wera, in Kasese, to make sure that if there is anything out there, we comb it. We have activated our lab in Arua. It is able to take care of that whole area, because, as I told you, Ituri is very near. It's less than, especially those places where the first cases were reported. It is I think, less than 100 kilometers from Arua. So we had to make sure that we station our we make sure that our labs are active, and we have deployed our teams. We have also built capacity in the human resource. We have built capacity in human resource to take care of any highly pathogen outbreak. So I think we were able to demonstrate that even during COVID, when even the highly organized, highly resourced, highly technologically capable, this COVID made sure that all countries were on their knees. But we were able to demonstrate in the country that we are able to deal with that problem internally, and we're able to minimize deaths. So even COVID, I mean Ebola, all the multiple times that we have had an outbreak here in the country, we have been able to deal with it. And in the last outbreak, because we have gained experience and the skill to deal with this epidemic, all our patients that had Ebola in our care, none died in the last outbreak. So it is very important that the country gets to know that we have built capacity.
Okay.
Yes.
Thank you. Prof, talking about Uganda's preparedness and response capacity, the PS has clearly highlighted some of the steps and how we've moved from one level to another to ensure that we combat such outbreaks. Let's talk about availability of isolation units and treatment centers, surveillance systems at border and health facilities, but also the protective gears, laboratory testing capacity, but also coordination between districts and the central government.
Okay, thank you, Jethro. Let me allow first to start with that. Definitely on the 15th, Uganda reported its first case which was a Congolese national, 59 years, who had been admitted in Kibuli Hospital, and he died on 14th. So we're able to retrieve blood and test, and we also did a declaration on the same day, which is according to international health regulations, that if you look at 7 by 7, you should actually be able to detect and notify within 1 day, but also respond. So we're able to do that. And so within the next 24 hours, we also were able to test and confirm the second case, who is currently admitted in Mulago isolation unit. So that already shows that its capacity, as the PS has indicated, that we have lab capacity. And also have capacity in terms of human resources to be able to manage this case. And I must say that actually the patient we have at the isolation is already on the path to what? To recovery. And we pray that she continues to recover. So we have definitely done a risk assessment, and we have looked at that our western border from Arua up to Kisoro is high risk. And we already have been able to deploy surveillance teams in all those districts from Arua, Sombo, Pakwach, Hoima, Kikuve up to Fort Photo and Kasese up to what? We have also deployed the lab in Kasese, so we don't need to transport the supplies, the lab blood to Kampala. It can be tested. And tomorrow, our lab in Arua will be functional, will be working. So we will deploy the epidemiologists. We have activated the district task forces, which are chaired by the RDCs and the secretaries by the DHOs. And we are looking at that. The most important aspect is that we want to monitor all alerts. And we have so far, by this morning, we have tested, I think, 16 additional tests, all of them which have tested what? Negative. And even this evening, we expect results from the laboratory. So the capacity is there. And we have also trained emergency medical teams, which were able to, like in Mulago, when we moved the patient from Nakasero, we're able to activate our emergency teams, and within 24 hours, they were able to report to the isolation facility. We have been able to identify all the risk contacts, all those ones which we consider high-risk contacts, and put them into isolation. Because we want to pick them as early as possible before they develop symptoms. Because when they develop symptoms, then they have a risk of spreading to what? To the public. So the capacity is there. In terms of supplies, we already have preposition supplies in all our emergency operating centers and all our regional hospitals from Arua, Yumbe, Hoima. All of them have emergency operating centers. And the supplies are already positioned. In addition to that, we have already notified national medical stores to be able to supply additional supplies. We're also working with the Army. Actually, the Army has been one of our key partners in response to outbreaks, and they're also able to deploy to be able to support our surveillance systems across the border. So the systems are working.
About ambulance readiness, emergency funding, these are some of the questions Ugandans might be asking.
Ambulance, we have definitely been able to repurpose, to designate some of the ambulances we have specifically for what? But we will be able to expand or to surge or to increase the number based on the response.
On the
because
demand
on the demand. So that is already being done, so that we have that. In terms of resources, definitely the government is normally the first fund of what? Has already provided resources. Because already the human resources, the infrastructure, the supplies which you have Those are all resources which we do, which we have. So the PS has mobilized, as she will speak to detail, mobilize resources within the available budget to at least be able to kickstart the response.
Okay, PS, kindly, if you have to submit something about emergency funding, that is if there is, before we go to border management and this cross-border movement.
Emergency medicine, sorry.
Funding.
Medicine is in my head.
You're a doctor.
Yeah, it is true. We you know, whenever we get emergency in the country, any emergency, like landslide or anything that threatens the population, we repurpose the money. And in this case, we have identified some resources within that we rather suppress other activities, and we make sure that we prioritize the lives of the people of Uganda that are at risk. And so, but we are also working with Ministry of Finance to make sure that we get more funding. And I think in the course of the week, because today was the first day, you know, we remember that we made the statement on Friday, and today is the first day. So we are still working with the Ministry of Finance, and I believe they will come through to support us. But also we are engaging the partners to see what else they can support. And today we had a meeting, and we are waiting for them to communicate formally what they are. But for me, I'm not worried.
Okay.
I'm not worried. We have come a long way. We've come a long way. Gone are the days that all the responses of such epidemics, we had to wait for partners to do everything. But now we know for sure that government is taking up a big chunk of that, and will continue. Because already we have deployed our teams on the border, in all those districts. They are doing surveillance, especially on all that western axis. Our teams in Kampala, that's how we're able to track the contact, the second contact of the first index case, because this second patient who tested is actually a sister-in-law of the first person who died. That's how we're able to track them and get them together with all the people they used even as they were coming into the country. And so we have got all those people. They are in our care. So that work takes a lot of time, because people have to move everywhere to comb and trace everybody who is connected to these contacts. So all that requires money, but we have already committed and we've already deployed. We have already secured some test kits. We are now treating this patient in our isolation. We have mobilized supplies through some of them from partners, but some are from government. So we are in a better position. We are not worried.
Before we go for the break, PS, the local border communities, do they really understand the danger of the disease?
We continue. We are going. Actually, that's the reason we are here.
Yeah.
That's the reason we are here, and we are going to continue to educate the public. It's not only the border people. Even here in Kampala, I was amazed when we sent out the statement, and some people said, "Oh, you know, these guys are lying, they want money," those things, how Ugandans can be really nasty. But you can't blame them. So we continue educating the public, and we are going to intensify, including all those border points, not just border points, because now these people traveled all the way across, they moved all the way up to Kampala.
Yeah.
So, and they went to private facilities. So we'll have to continue educating our people to make sure they observe certain minimum measures to make sure that they are safe, they are protected, and we control this outbreak, and it does not come into our country again.
All right. I do have some questions and feedback as we go for that break. Good evening. This is David in Saba in Kabale town. One of the biggest threats of Ebola should be expected through our Uganda, DRC border in Chisoro district, because DRC citizens daily stream in large numbers through Kabale to Kampala by buses. Not less than 10 buses leave Chisoro carrying mainly Congolese. Also, so many minibuses leave Chisoro heading to refugee camps hosting Congolese. What's the response of the PS to that? Okay, thank you. My name is Karl Marx. My question is, should we expect postponing of the date as students shall go back to schools? I think that is noted. Good evening. This is Afema Aldo watching from Arua City. Thanks for the show. What can be done to busier places like schools, marketplaces, and churches? Border markets, please, are a hotspot. There is totally no control in here in areas near Arua district. Thank you so much for being